Dr. Michel Furtado obtained his dental degree in Brazil in 2003. After 2 years in private practice, he was accepted for a Master's of Science degree at the University of Toronto, where he researched the events in bone healing and implant surface characterization. In 2013, Dr. Furtado completed his specialty residency in periodontics and Master's in Dental Science at the University of Connecticut. After residency, Dr. Furtado obtained his distinction of Diplomat of the American Academy of Periodontology as a board-certified periodontist. He has been a periodontist in Melbourne for 9 years and a owner of Solid Bite for the last 2.5 years. So without further ado, I'd like to welcome you to the EG Dominates Dental podcast. We are in Melbourne, Florida today with
I was down, but now I'm up. Yeah.
Dr. Furtado. Thank you for joining and being on the show today. This is the first episode of the EG Dominates Dental podcast, and we've worked together for a couple of months. And we've started to talk a little bit about, kind of your past. And I think that you probably have an amazing, remarkable story to tell. So I'm excited to hear about your journey, from the time you were young until present day. And the whole premise of the show, of this podcast, is I wanted to give general dentists and dental specialists a platform where they could showcase their practice, but also give patients an in-depth view of who they are as a person. I think that in the dental industry right now, patients specifically are doing a lot of research when it comes to finding dentists. And when they get referred to a specialist, especially like yourself in periodontics, I'm going to go to the website. I'm going to do my research to find out, who you are, where you're from. And by allowing a platform where you can discuss who you are, where you're from, what your principles in business and dentistry are, what's important to you, what you value, is something that I think people will find an emotional connection to. I also think that this fills the void for referring doctors. I think that there's a lot of referring general dentists in the community that refer patients to specialists, and they might not know who that doctor is. I've been referring to him for 4 years, but I think we've talked on the phone once or twice. I really don't know that much about that doctor. So this is a good way for people to get to see you in that light as well. So thank you for joining the show today.
Well, this is a great pleasure. It's an honor for me to be here. It's great to know that it's the first episode. I hope that I fulfill the expectations. It's an honor to be here. I think is a great idea. That connection between patients and their specialists and the referral dentists and their specialists is sometimes lacking or incomplete because the day is so rushed and we have so many things to do that we don't get the full picture of who is the person who's treating you, who's the person who's working with you in such an important aspect of your life, which is your oral health. So I commend you for this. I love the idea. I think it's very creative, and I'm very excited to be here. Thank you.
Thank you. So let's talk about Melbourne. Melbourne is the east side of Central Florida, right along the Atlantic coast. I've been coming down here working off and on for the last 10 years. And I've seen just a tremendous amount of growth, not only in Central Florida, but in this area as well. Before we kind of start to talk about your beginnings, why don't you tell us about what you've experienced from growth in the community and kind of how that's allowed you guys to, it sounds like you guys are in works to open a bigger practice.
Yes. So
start there. Tell me a little bit about that.
I've moved here in 2015. It's been 9 years. So these 9 years, Melbourne and region, Brevard County has changed a lot. I can only speculate that South Florida's grown too much, or people are trying to get away from South Florida and getting to Central Florida, and we are right at the East Coast, in the ocean. So we are very well located. We're close to Orlando, so this area is very desired now. We've noticed that growth in population and in dental needs as well. So there's a lot of general dentists that moved here. There's a lot of new families that moved here, of different ages. This was known and still is known for an area that attracts snowbirds. So older families, people that are in their retirement age will stay here 6 months and then go up north for 6 months. But now we see an influx of families that are of different ages, and so the dental needs have changed and increased as well. So this is a practice that's been established in 1980.
Wow, long time.
Yeah, and I was fortunate that I got in about 10 years ago as an associate, and been a co-owner for about 3 years, 2.5 years, and our space is just not enough anymore, and we have big dreams and big plans for attending the community, for helping these new needs that are have surfaced. So the idea is that we're going to open a practice that's probably double the size that what we have right now.
Nice.
And so that we are not limited by space.
Sure.
Hopefully get an associate or two in the same areas of surgical restorative treatment, and focus on what we do best.
That's great. Yeah, there's definitely a huge need as the population is growing in this area. And I'm definitely starting to notice and tell too, you're starting to see a lot, to your point, younger families moving to this area. You're starting to see a lot of master plan communities being built, first-time home buyers. So the age of the population is starting to come down a little bit, but just the amount of growth, you need to have an adequate number of specialists within the community that's going to be able to take on all of those needs in a timely manner. So that's awesome. Really good.
Yeah,
so take me back. So you've been in the United States then for since what, 2002, 2003?
2000 in the United States, 2009.
2009 in the United States. Okay.
Yeah, 5 years in Canada prior to that.
Okay. So take us back. Take us back to the beginning. So originally from where in Brazil?
From southeast Brazil, a state called Minas Gerais,
Okay.
which has a fabulous food. Culinary there is amazing.
What's it known for?
It's just local foods like rice and beans and meat and vegetables. But there's so much. I mean, the food is so rich that I'm salivating now. So it's a state that's inland. It's about 4 hours, depending where you are. The closest is about 3-4 hours from the coast.
Okay.
But it's in one of the most developed regions of Brazil. So it's southeast and south are where you see most population and most advancements in technology, the best universities, and it's a state that's very hilly, and it's the scenery is beautiful too. Lakes, waterfalls, and
More kind of like a jungle atmosphere, or is it wooded and mountains, or what's the terrain like?
It is very mountainous and foresty.
Foresty.
Yeah.
Okay.
It's definitely not as dense in concrete as São Paulo or Rio.
Sure.
But it's in the same area. So the development of that region is the highest in Brazil.
Okay. So born and raised there?
Born and raised in a very, very small town there.
Okay.
15,000 people in this very, very small town. My mom was a middle school, high school teacher.
Okay.
My father was a small business owner, auto parts, in a very, very small town. So everybody knew everybody.
Mm-hmm.
I'm one of 4 sons.
Okay.
So we were about 2 years apart. I'm the second son of 4. It was very fun growing up. You grow up free. That's one of the reasons why Melbourne was very attractive to me when I came here. And I always chose in the U.S. cities that were smaller, so that the goal was always to get my family, or my future family, my future kids at that time, to experience that freedom. To not be confined to an apartment, or be concerned about safety or security of the premises around the communities where we lived. So that town where I grew up until 11, it was just everybody knew everybody. We were in the streets playing soccer all day. School, home, lunch, soccer all day till lights are out, or biking, or playing real kids.
Yeah. The 80s was definitely a different time compared to what our kids go through today, right?
Oh yeah,
Yeah.
yeah. We had energy, and and they knew how to spend that energy. I mean, they'd let us do, parents and neighbors, and they knew they all had kids,
Yeah.
so they knew we're up to no good, and they're to a certain extent okay with it.
Yeah.
Because we're not saints, and kids are not. It shouldn't be. So it was a very rich childhood. So 4 brothers, rough play normally, and we grew up to be very good friends in teenage years and young adults. We were always as close as we could be, but it got into a point where my parents wanted a better education for us. So my older brother was sent to the capital of the state. At the time, it was probably about 3 million people in the capital of the state, to get a better education. So he was sent to live with my grandma,
Okay.
and I was sent to live with my uncle, my godfather, in a medium, a bigger city that had a college and was very, very student life.
So you were what, 17, 18?
No, I was 11.
Oh, really young.
Yeah.
Okay.
Yeah, really young. So, because my parents wanted us to get, middle school to high school, because those years was were the foundation for you to get into the university. In Brazil, the system is there's no college in between high school and university. So there is an exam, and at that time there's not as many universities as there are there now, but the exam was very, 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 very competitive if you wanted to get into the public schools. So
Okay.
the state schools and the federal universities, there was an exam that anybody in the country could take, and the best would be selected to get in. And the advantage is that, you didn't have to pay. My parents didn't have money to pay for all of us for private schools. So their idea is to get us a better education, and then my brother was sent to the capital. I was sent to a different city. And my 2 younger brothers stayed. And the area where we lived kind of grew a bit, so my parents were okay with just sending my other brothers just to go back and forth by bus to a neighbor city that was bigger, that had better schools. But my older brother and I were the ones who were sent a little farther away. Not too much, like 4 hours, 3 hours drive, but very young.
So in order to get what your parents and your family felt was going to be the best education, in order to do that,
Yeah.
you guys were displaced
Yeah.
with family members or friends in order to get into better schools, better technology, better chance to get ahead to expand the future.
Yeah.
Wow.
Yeah. So it was very competitive to get into the best universities, and that's what our parents wanted for us. So I stayed about 3 years with my uncle, and then my parents, sensing that the younger brothers would need to do that too, and they thought, well, we can't send everybody out, and where are we going to be? We have to be with them.
Yeah.
So they moved to a different city. There was this university. So the same city where I lived with my godfather, they just switched places. They had the same business, the same auto parts shop, so they switched places, and they were in different stages of their lives with their kids. So my parents moved to the city. So my brother came from the capital. I stayed in the same city where I was. I was just living with my parents now.
Okay.
So the 6 of us were together again. And that experience into the teenage years and trying to choose a profession, which I think it's extremely difficult for someone at 17, 18, 19, even 20, 25 to choose what they're going to do for the rest of their lives. So the experience in that city, it's called Viçosa. It's a college town, I would say. One of the best schools in the country for what it had, the courses that it had. It was more courses on the agribusiness or forestry or other things that are not on the medical field. That was one of the best universities in the country. Most of the professors of that university had gone abroad to do masters and their masters and their PhDs to come back and teach
To
there.
teach it. Wow.
So the influence of the U.S., Canada, Australia, England, a lot of the English-speaking countries to that city was great, because a lot of the kids my age were sons and daughters of the professors of that university. So that instilled in us I wouldn't say the will to study and do stuff, because I was not as dedicated as I would like to be, knowing what I know now, but at least the desire to, reach a little higher. What about, living abroad and having that experience? So that, at a very young age, that seed was always there. So it was a great thing that my parents did. I bet it was not easy for them with 4 kids to change that.
Can't imagine.
Yeah. So we always had everything we needed. We didn't live in abundance, but we lived with everything and more than what we needed to thrive. So I was very fortunate, especially in a country like Brazil. It's not it's not the story you're going to hear for the majority of people there.
At this point, do they teach English in the school system there?
Yeah, even the public schools that, middle school and high school, the public ones, which are not the best, there is kind of reversed. The middle school, high school, the private schools are better. When you go to the universities, the public schools were better.
Really?
Yeah, it was
It's like the opposite.
quite the opposite.
Mm.
So at every level, you have one of the disciplines, one of the disciplines you had to study was English.
Okay.
And at different levels, you're not expected to carry a conversation like we're having right now, but you start with the verb to be, and then you go
Sure.
from there. You know the basics, and the influence of the American culture there is, at least at that point, I believe it's the same now. Was especially with social media. It was tremendous, because music was in a lot of the bands, and music was in English. Movies, everything was English.
You told me a story a couple weeks ago about how you were in a band.
Yeah.
And how learning and memorizing the lyrics in English help you to learn English better, and adapting to the English language. Talk to us about that, because I was pretty blown away to hear, number one, that you were in a band.
Yeah.
But number two, that you're also playing musical instruments and you're learning a new language and you're doing all these things. So how did all that come to be?
Well, my family is very music oriented, I would say. We don't have a lot of musicians, but we are music lovers.
Okay.
So I've always every type of gathering at home is not a small family, 6
Big ones, big gatherings.
and everything was around food and music. So we would listen from all sorts of music from a very young age to now.
Mm-hmm.
So the music is a lot of influence in what we did growing up, and my father started to pick up the guitar, and he wanted to have lessons. And one day, I think I was 7 or 8, and this guitar teacher would come to our house. This is in this small town still, and I was watching my father having the lessons, and he was having trouble doing the chords, and then I told my Dad, give me the guitar, let me do this. And then I did it just by looking at them. And then the teacher said, you should have him do the lessons too. And then that's how it started, playing the guitar.
A young natural.
I don't know. I just liked it very much. I liked the sound very much. My brothers are pretty much alike. We would pretend to have a band. One would play the bass, one would play the guitar, one would sing, the other one would play the drums, and kids. And that's where he started. And when we went to that city, that college town, I was very influenced by my older brother, who started listening a lot to classical rock, and we're big fans of Led Zeppelin. Led Zeppelin, Deep Purple.
Love Led Zeppelin. Yeah.
So it's still my favorite band, and at high school, we had some people that play. I'm like, why don't we form a band? And then in my house, there was a garage that was big enough, and we took the instruments there and started rehearsing with national music first, and then we thought of one. I don't know whose idea was that, and we said we should play Led Zeppelin. And there was a song called The Rover, and the intro is very, very typical, very, very unique, like all Led Zeppelin songs, and they started playing, and I was like blown away. Like, no, I have to learn how to sing this.
Yeah.
And so what I did is, internet was not as easily accessible as it is today, especially where we were. So, I try to find the lyrics as well as I could. Like, I have to learn how to pronounce this well. And to me, English was English. I couldn't. It may sound weird now, but I couldn't distinguish between Australian accent or the British accent or the American accent.
Mm-hmm.
And to me, the songs were all American, knowing that Led Zeppelin was a British band. So I wanted to sound like Robert Plant, as impossible as that can be. And one of the things I wanted to do with excellence is pronounce the words like he did. So that helped me a lot because
the enunciation of how he's saying the words.
Yeah.
Yeah.
So I wanted to know exactly how to say the words, how to sing the words, and efficiently. And with that came, I wanted to know what he was saying. So a lot of my English comes from that. A lot of it.
Researching like the definitions to different words and phrases, and
there are slangs and things. Like there's a song called "Out on the Tiles." I didn't know "Out on the Tiles." What did that mean? And so some expressions I've never heard in my before. Knowing a little bit of English and being curious about the language, so that helped me a lot. And I about "Out on the Tiles," I came to learn what that was with my previous supervisor, my research supervisor in Canada. He was Welsh, and that seems to be an expression, a Welsh or a British expression for getting out and getting drunk.
Okay.
So having fun. So that's see how that kind of connects, because I learned that at 14, 15, at 28, 29 is when I met that supervisor, and then I was talking to him about Led Zeppelin, and I don't know who mentioned "Out on the Tiles," and then he said, "You know what that means?" I'm like, "No, I like the song," and then he explained to me.
That's incredible. Wow. So you do the band. You're with the band through high school. You're learning English. At what point did something dawn on you that you potentially would be interested in pursuing a career and education in the dental field? Or did that happen before you got to college, or was that something that you didn't really feel passionate about until towards the end of your college undergraduate?
Well, I didn't know enough of any profession to really be certain about what to choose for the rest of my life. So my brother had gone into dental school, my older brother. I knew I liked the areas of biology, chemistry, more than the exact areas, that math and physics, and so. And I like to deal with people. I always like to, have established relationships, and so there's always in Brazil. Medicine, being a physician was like the highest of the achievements at that time.
It's like the pinnacle.
Yeah.
In the career field, right?
Yeah.
I'm gonna be a doctor.
Yeah.
That's what everyone, I think, growing up kind of strives, or things that they want to do, even though they don't really know about how much hard work and everything that goes into it, right?
Yeah. And I never thought specifically about being a physician, but I wanted to be in the medical field. I knew that, and my brother was going to dental school, and I said, I'm going to try. I don't know. And I did not want to get into a private university because I didn't feel like my parents would, because the system is very, very, very different. It's not easy, or I dare say possible, for a young adult to go to a bank and say, hey, here's the letter of acceptance in a private school, can I get a loan? Even if I had credit or it's not, that doesn't happen.
Sure.
And even if it would happen, the interest would be prohibitive,
Sure. Yeah.
So I wanted to go to a federal university, to a state university, or public school, so that my parents wouldn't have to pay for that, because that was expensive. And so I spent 2 years writing the exams. So the first time I tried, I didn't pass. So I went to a prep course for the next year.
This is like a preparation for like an entrance exam to get accepted to the school?
Yeah,
Okay.
it's an exam that has math, physics, chemistry, biology, English, Portuguese, writing, and then there's a multiple choice first and an open-ended question second. So they're filtering the best ones, and that's how they select candidates, which is completely different from the way we do here in the U.S.
Yeah.
I think the way we do in the U.S. is better to select, because you really know who the person is.
Sure.
Now, knowing there's a personal thing to the process. There's an interview. There's an intent letter. There are recommendation letters from other people. So, how was the past of that person.
Yeah.
So, it took me 2 years to get into dental school, and it took me about a year and a half into dental school to realize that I loved it. And looking back, I don't see me doing anything else. And it just, every day I'm very grateful. And this is honest to God. Every day I get into the office, I'm very grateful, because I know there's people in my family. I know a lot of people around me, people that I love, that had a really, really hard time with the profession they chose, and they had to change directions midway.
Yep.
And it was such a traumatic event for them that I look back and I'm like, and it's not that I love every bit of dental school. There's certainly some subjects I didn't like, but I love being a dentist with all my heart, and I'm so fortunate that I was able to choose that at a young age and continue to do that.
There's so many people these days that get a degree and get a job, and 2, 3, 4, 5 years later, they're miserable.
Yeah.
Because it's something that they either enjoy doing, but it doesn't pay the bills, or it barely pays the bills, or it doesn't allow them to live the kind of lifestyle that maybe that they wanted. Yeah. So the fact that you were able to get into dentistry and know relatively right away that was the best choice for you is something that I wish more people could experience.
Me too.
Yeah.
And that makes me like even more the system in the U.S., because having that college experience kind of gives you at least a cushion to kind of explore. It's not unusual that you go and travel for about a year, or I don't know, or shadow someone in your area for about a year, about 6 months. You go to college. At least you test the waters first.
Get some experience.
Yeah. You get some exposure, and you see, you know what? I thought this was what I wanted. Now, someone comes and shadow us in the office. I'm like, this is how the dental life is? I don't know if I want this.
Mm-hmm.
I thought I wanted it. And there's, within dentistry, there's so many facets of, how the day-to-day is, that even coming here and maybe really thinking that you like this, you go to an orthodontist office, it's like, whoa, this is completely different. An endodontist office, that very well, it's completely different.
The workflow is so much different from office to office, depending on the type of procedures that you're doing and how much chair time it takes. People don't realize being a dentist is very, very hard. It's very demanding, because not only are you a doctor full time, but in a lot of cases, if you own that practice, you're also a full-time business owner.
Yeah.
And that's something that I think a lot of grads don't spend maybe enough time thinking about, because they're like, man, I did it, I made it, I'm a dentist.
Yeah.
And then, they take all these loans out, or they join a practice, and now they're doing not only the clinical side of things, but now they're also learning and trying to figure out how to run an effective business, how to coach and develop and manage people, profits and losses, marketing. There's a lot that goes into it.
Yeah, I mean, you're so focused on the clinical and the technical aspect while you're in dentistry because you want to be a good dentist, or you want to just go through that. The perspective, at least that I had as a dental student, was very focused on dental. I didn't have much time to think about anything else. Very, very limited budget. I was living away from my parents and my girlfriend at the time, who was my wife right now, and we had plans together. And so, weekends I had to study or go back to my hometown where my then girlfriend was and my parents lived. And there's not enough time within my experience of dental school that taught me anything about business, anything at all. And being in the dental field, culturally in Brazil, you're a healthcare provider. And that kind of comes with the mentality of you're providing health, and if you seek for profit is ugly. It becomes dirty. Because to that mentality, if you look for profit, it doesn't matter how much, even if it's a bit. At least the mentality I had and that I was surrounded by was it was not right. You're providing health. Profits will come, money will come. And, talking about sales. And
you didn't go
ugly.
to school to be a dentist to get into sales. And I think that there's a big misperception out there.
Absolutely.
I think that the dental field is from my experience, it's one of those aspects of healthcare where, patients are skeptical sometimes. And maybe they've had a bad experience in the past. And I really feel like, with the advancements in digital technology over the last couple of years, it's really helped to illustrate and allow doctors and their teams to give visualization to what it is that you're trying to explain to patients. Yeah. Because, I don't think that there's too many people that would go to an optometrist for a checkup and they would say, I'm really concerned about the amount of pressure that's starting to develop behind your left eye. And you would say, oh, well, I'm good. I'm not really feeling any pain or discomfort. So, we'll see you next year, Yeah. But in dentistry, it's a lot different. It's like if you're not in any pain or discomfort, a lot of times people aren't willing or wanting to listen to something that might be early signs of prevention in order to make sure that you have longevity and sustainability with function, stability, and quality of life, for the rest of your existence.
Yeah, it's those things you don't learn in dental school. How to establish trust with a patient. It's a trust relationship. It's like you said, your example about the optometrist. It is a vulnerable position for the patient to open their mouth in your chair. It is. And they have to trust you, and they have to believe that you're good at what you do, and you're doing that the best way you can with their interest in first place. So that you don't learn. And communication in dental school, you don't learn. Those are things that you pick up, and let alone, knowing the amount of English that I knew before coming here. Yes. I open my mouth. I know I'm an immigrant. And when I moved to Canada in 2005, I could barely speak. Despite the experience that we talked before about singing in a band and learning a little bit of English. This is a completely different animal from going from dental school, dental practice in Brazil to master's and PhD and wanting to become a professor and a university. So learning the language, understanding how to communicate and how to present yourself in the science community first, which was my goal, was a trip.
Once you became a dentist, at what point did you decide that you wanted to go back to school for higher education to become a periodontist? Like, how did you pick that specialty in dentistry?
Well, in Brazil, dentistry is very, very competitive. There's a lot of dentists. There's not a regulated is not as regulated as it is in the U.S.
Okay.
It's I would say it's the opposite of what you see in the U.S. There's 1 out of 5 dentists in the whole world is in Brazil right now. So many dental schools, and
1 out of 5.
yeah, there's more than 600 dental schools in Brazil. And Brazil is a country that I'd say 210 million.
Wow.
Yeah,
That's a huge number.
yeah.
Yeah.
The state of São Paulo, you know, the most developed state in Brazil, has more universities, dental schools, than the U.S.
I didn't know that.
Yeah, so it's very competitive. So you get out, you have to think of ways how you differentiate yourself from others. For that, you kind of have to have money, because you know there's only so much you learn in dental school. You got to go for specialty programs, or a master's or a PhD, which don't make sense. They don't make sense to me. If you want to become a better clinician, you go and spend 2 years of a master's doing the research in a lab,
Yep.
or 4 more years in a lab doing a PhD, and then you go back, you become a better clinician. And you know, it doesn't. But that's kind of a career in Brazil. The more accolades you have in your card or in your office, the more trust or the more authority you portray, and then that's how patients see you. Oh, that person is a professor somewhere. They have a PhD, they have a master's, they have 3, 4, and then it's not uncommon in Brazil to have 3, 4 specialties, because the specialty programs are once a week or on a weekend, or 3 to 4 days a month for 2 years. So that's the market. And there's the beauty about the market regulating itself. That's how the market regulated itself in Brazil. The greatest advantage of that is the population in Brazil really needs dental treatment, and the cheapest dental treatment, best dental treatment that the population can have is when the patients that go through those specialty programs, or they go to the federal or public school universities, where they get free treatment or close to free treatment.
Because you know that they're going in, at least getting seen on a regular basis.
And the students, that there's no prerequisite for you to graduate in dental school in Brazil, because you know you're gonna do enough.
Sure.
More than enough. So the clinical exposure, comparing the systems in Brazil and the U.S., in Brazil is like amazing. You're exposed to everything if you want a lot. Here is more like driven to, all right, I have to do this many root canals on an anterior tooth or a posterior tooth, or this many fixed partial prosthesis, you know. With this many dentures, this many crowns, this many implants. There is like, what do you want to do? You want to focus on surgery? All right, that's as a dental student, you can do third molars. Like, how many do you want? Well, perform well in that specialty with your normal grades. Get like a mentor like one of the professors to mentor you, and you find the patients, which are plenty, and you say, you talk to that professor. I'm like, I want to do the molars of this, the thirds of this patient. When can I do it? I'm like, okay, we'll get the surgical block scheduled for you, and that's it. So
what year did you decide that you wanted to become a periodontist?
I always liked surgery. And the example of third molars here was a real one.
Sure.
I always liked surgery.
Okay.
Periodontics in Brazil is very different from what it is in the U.S. There's the concept of hygienists in Brazil is not as developed as it is here. We have them there, but they are not a must for a practice. The vast minority of practices have hygienists, if at all. I mean, it's not very common. And so periodontists were known for doing the scaling, root planing, and then so it's mostly treating periodontal disease.
Yep.
And so the reconstruction of ridges, bone building, and gum grafts and all of that more advanced surgery came much after, when they realized that periodontist had some finesse to deal with soft tissue. So by having experienced treating periodontal disease, which is tough, very tough, doesn't hurt.
Yep, doesn't hurt.
Ever. So the patients don't want to do it. It's a chronic disease that for which we don't have a cure. We know how to control it really well if we know what we're doing, if we know how to diagnose and treat. And basically in Brazil was composed, periodontology was composed of scaling and root planing, and then sometimes a flap surgery, or a flap surgery with some bone graft, guided tissue regeneration. But the experience of manipulating soft tissue, manipulating membranes and bone grafts around teeth to try and save bone, or preserve gums around teeth that were maybe doomed to fail 30, 20, 40 years from now, that ability, I think, just gave periodontists the port of entry to do more advanced procedures there. Here, I knew it was already there. I knew that periodontists were not doing prophies or scaling and root planing.
In the United States.
I knew it. So when I saw that, and I didn't like the trauma part of the oral maxillofacial surgeons. So I didn't want to be an oral surgeon because I didn't like the trauma part, the hospital license part, the on-call part of that. Was not the surgery that really, even third molars today, I don't like them. Mm-hmm. I much rather do a complex ridge augmentation or full arch reconstruction for implants and fixed prosthesis over implants than doing a trauma. So I knew that then a bit, not as much as I know now. I knew that I wanted to do oral surgery, but not trauma. And to go for oral surgery, for oral maxillofacial surgery specialty, would be about 6 years for me at that time, and I didn't want to do that. Perio was 3 years. Okay. So all of those things just led me to Perio. But I had no idea I wanted to revalidate. I wanted to go back to the clinics. I came to Canada with the clear vision, me and my wife. At that time, she's got accepted for a master's in her area. She's a forest engineer. And
she's a forest
engineer, yeah.
Wow. Living 20 minutes from the beach in Florida.
Yeah.
Okay.
And she, again, her family is full of forest engineers. That's a family trait. And, they're very, very smart people. And she wanted to do master's, PhD, and become a professor. Her father was a professor at the university of that city that we grew up. And I wanted the same. I wanted the master's, PhD, and become a professor at the Faculty of Dentistry, hopefully at the University of Toronto. And at the end of my master's, I realized, no, this is not what I want.
It's not what you wanted.
I missed the, treating patients. And I had no idea. I had no idea of how to revalidate, how to get my degree revalidated in Canada or the U.S.
Yes, this is a good way. So let's segment now to talk about that. So you graduate, you want to get revalidated, right?
Yeah.
I know that you also have a couple businesses that you do, and you work with some other people on the side and helping people get validated.
Yeah.
So kind of walk me through that, because that's very fascinating. I think there's a lot of people that are that know a little bit about it in the United States, but I think that's something that's very, very interesting and intriguing, and it really speaks testaments to who you are as a person, because I think you're a great person here.
Thank you.
And I think when you're a good person here, when you're trying to build that trust and you're trying to build that relationship with patients, as an example, I mean, people gravitate towards that. So that was one thing that I picked up, from you right away, is that genuinely good person with good intent. So tell us a little bit about this program.
Well, so after finishing the master's and wanted to revalidate, what happened was I didn't know anything. And I told my supervisor, we had the PhD project almost ready.
Okay.
And I was involved in many projects in the lab. That's why there's many papers that I published that, even though I have a master's in Canada and a master's in Connecticut with the perio. I was always fascinated by research. I did research even in dental school. So I told my supervisor, I did not want to go all afraid of telling them, because there's a whole plan, and his lab had the whole plan. And I felt so bad. I felt so bad about disappointing him. And he was such a great mentor to me. And he doesn't know that. I don't think he knows that the extent that he was important in my life.
What's his name?
His name is John Edward Davis, Jed.
Let's find him. Let's make sure he sees this episode.
He's
Shout
famous.
out.
He's well known in the dental community for surface characterization of dental implants. He is one of the big guys who started that, and who really did relevant research, very important research on that aspect. And then he started with stem cell research as well, which now is being shown to be, his points at that time, which are not very believed, I'd say they're not proven yet, I think. Now we know that a lot of the ridge augmentation that I do today, a lot of the grafts that I do today, the biologic principles were described by John Davis at the University of Toronto.
Wow.
Yeah. He's the one he started researching on mesenchymal stem cells on the umbilical cords of horses. And that's because you have a big extension. You have so there's more cells that you can culture. Mm-hmm. And his main hypothesis, and his main rationale was the stem cells come from cells that surround blood vessels.
Yep.
So they're called perivascular cells, PVC. I remember that really. And those cells, if cued the right way, they'll be invited to the wound site, and they will differentiate into whatever lineage of cells you need. So if it's a bony site, and there's new blood vessels going in as part of the healing process, the cells that surround the blood vessels that are forming are cells that have the capacity of differentiating into different tissues: gum, bone, tendons, periodontal ligament, and you name it. So he started that there. He has no idea how he was important to me, because he was very ethical for everything. I mean, very, very, very meticulously ethical. Every relationship he established with everyone in the office, in the lab, was a very intense relationship. He was he was there. He was present for all of us. And there are students from Iran, and there's students from Australia. I was from Brazil. There's some from Colombia.
All over the world.
All over the world, Canadians. And some engineers, some physicians, some dentists, some anatomists. So you learn so much. I learned so much from that group.
That's awesome.
And it was such a rich experience. And I could barely speak English. I could barely speak it. I don't know how he's accepted me. Because my plan from Brazil was to apply for a perio professor at the University of Toronto. And he had accepted me through email. The process of getting accepted to a master's at the University of Toronto was you have to pass the TOEFL with a certain score, and I did. You had to have a grade from like a GPA from dental school. Sure. That was a certain level, because they discounted for Brazilians. They discounted for different nationalities. They'll discount for a certain amount. So I passed that as well. The third level was finding a supervisor, because master candidates had to have a scholarship. They were paid.
Yes.
From funds from research. So I found this professor, and my wife and her father went to a conference in Toronto at about the same time, and they walked from their forestry department conference all the way to the dental department, to try to find this professor or other professors. I gave them a list. So I didn't have the money to travel with them and do it myself, so they did that for me. And it was like vacation time, and there was nobody there. There's no professor there, and they found someone who happened to know my father-in-law when my father-in-law went there to do his PhD.
Wow.
So my father was there in 1982 for a PhD at the Department of Forestry at the University of Toronto.
Okay.
And he played soccer, and he was a defender. And the final of the intramural league was between forestry and dentistry.
Forestry versus dentistry.
Yeah, the final of the intramural league,
the championship
1982,
game.
I guess, 82, 81. And he was defending against the striker who was a dentist, who was the dental student at that time, or a researcher at the dental department at that time. And they were walking at the dental department, to look for a supervisor for me that would accept me because I passed the other two levels. And they didn't find anything. And suddenly someone comes and asks them, do you need any help? And they explained to this person that they're looking for professors. They had a list. And this person said, well, everybody's on vacation. There's nobody here. You may find one or two. And then he pointed at my father-in-law. I said, I think I know you. I know you from somewhere. And then they started talking, and I can't believe it. You were the striker I was marking on that final.
That's the connection.
Yeah.
Like it was meant to be.
Yeah, and then he pointed them to a Brazilian researcher that was at the University of Toronto. And then I was able to reach that professor. That professor accepted me legally through an email. So I had everything. I sold my practice in Brazil. We got married. And we moved. My first week at the University of Toronto, I went to visit his lab. And then he told me, I can't accept you. I don't have funds for you. I accepted another student. And my wife started her master's already.
You were already there.
I was there.
So what'd you do?
So the first reflex I had is I was at a student visa, so I couldn't work. And I would never do anything illegal because I didn't want that to taint my possibility of getting a Canadian green card and becoming a Canadian. My wife was born there, so she was Canadian. What happened was that we didn't have enough money. And we were living on the university's complex where everything was cheaper, but you still had to pay. So she started working to provide, and I started to try and volunteer anywhere I could. So through Brazilian connections, I'm like, who do you think can accept me as a volunteer in their lab? I want to start my master's, and maybe. So I went to Jed's lab, John Davis' lab, because his trusted postdoc student was a Brazilian.
Man.
And she met me on a Saturday morning. She took me to the and that's another huge mentor I had. She's like a sister I never had. She took me to the lab on a Saturday morning. I remember vividly. We walked the long corridor of the Institute of Biomaterials and Biomedical Engineering at the University of Toronto, because that's where the lab was. Mm-hmm. He was affiliated with the dental school, but we were at the biomaterials sector.
Okay.
Because his main thing was characterizing implant surface and developing bone biomaterials, and then later on stem cells. And she showed me the studies and are you interested in any of them? Do you think you can help us with any of them? Like all of them. Just I want to work.
Yeah.
Whatever you think I can do, I'll learn. I'm here. I was like hungry. And she said, okay, you come on Monday. I'll introduce you to Jed, to Dr. Davis, and then we'll see. And then she introduced. I went on Monday with the broken English, and he was very nice. And he said, "I don't have any funds for you, but if you want to start volunteering," and this was August of 2005. If you want to start volunteering, whenever I have funds, if everything goes well, if we are a good fit, whenever I have funds, you can start your master's. I'm like, deal.
That's how it started.
Yeah. Then it was like 12 hours a day, every day, there, all the time.
That's awesome.
And,
Man, that's a great story.
Yeah, he was amazing, and I learned a lot with him, technically and as a person too. He was very, very. He would tell this. The way he would interact with people mesmerizes me to this day, because he would never. He would say the same things, use the same, or say the same context, or use the same context with you and me. But he had the ability to read you in a way that the words he would use with you would resonate with you and only you. And then he would say the same things to me, and he chose his words so carefully, with a beautiful Welsh accent.
See, but look what you've been able to do. You've been able to pick up on all of these things that you've observed from mentors and other people along the course of your pathway to get you where you are now. So I'll tell you what, we can tie this whole thing up really nicely, right? So I think of all these experiences that you shared with us on this show, and kind of how it's helped to shape, you not only as a dentist and as a specialist, as a periodontist, but your values and your core beliefs as a person. Talk to us a little bit about how all of that has kind of shaped things up to, kind of allow you to see what that patient experience should look like. Not only for patients that are looking for you guys, that find you online or on social media, but also if a referring dentist was to send a patient to you as well. What is that patient experience in your mind? What do you want it to look like? What do you want it to sound like? How do you differentiate, what your patient experience is going to look like compared to, the industry standard?
Well, I owe this to my mentors, the fact that their presence, their intent with whoever they are interacting with should go forward. That's what I think the relationship with a patient should be. My assistants know this very well. They're very well trained. I want them to know dentistry a lot because I want them to anticipate what I'm doing.
So you spend a lot of time coaching and developing.
Absolutely.
Okay.
Absolutely. They have to know. They have to.
Yeah.
And sometimes it's a joke. You've probably heard that in the surgeries you've seen, like, stop reading my mind. I tell them, stop reading my mind. It's mind-boggling. I mean, I don't like that, because and this is a joke, I want them to, but they know that I'm there, and my intention is to be there and give my all. And sometimes, the day is a very hectic day. A lot of times the day is a hectic day. And they're like, hurry up, we need to. I'm like, no, I'm with this patient. I have to, the other patient, if I'm late, 30 minutes, an hour, 2 hours, I'll go to them and I'll tell them, I'm so sorry I'm late. I was caught up in the surgery. I apologize, but I bet that you will love it if you were that patient and you needed me there.
Yeah.
You didn't need me to rush. So that's the type of experience I want to, pass forward. That's how I learned to be present, to have the intention of being there, and to give him my best. I owe a lot to dentistry. I owe a lot to the people that mentored me. Lee Sheldon's one of them. He taught me everything about marketing and communication with patients, and I owe this to him.
The things that they don't teach you in school.
Absolutely, everything that I didn't learn in school, I learned with my mentors, in and out the dental field. So that experience to me is rich, because they see, and I hope they see that in me. They see that I am there. I want to be there. And when I'm doing a new patient exam, I am present. I look in their eyes and I ask them, is there any questions you have? I'll answer your questions now. And they'll ask. And if they don't ask, my assistants are trained to ask questions for them, because sometimes patients don't know what's going to happen.
Sure.
And the assistants know. They've seen that 1,000 times. So I have the assistants ask questions for the patients. And the questions may put me in the corner.
It opens up that communication
Yeah.
a lot of times as well.
And that's fine.
Allows somebody to feel more comfortable.
I want them to know. I want the patients to know, coming from a referral, directed from the marketing that we do directly to patients. I want patients to know that I'm fully there, and that I'm employing everything I have at that moment for them. I make plenty of mistakes, but my intention is to be as intense and with the best intention and presence as possible. Our new patient exams are about 2 hours, and it's not by chance. It's because we want to establish that relationship.
That's incredible. I mean, that speaks volumes about what you guys are doing here, what you guys are trying to accomplish. Well, thank you so much. I'm so glad that I had a chance to get you on the podcast, get a chance to kind of, hear the story, how you got started. How do people connect with you? If I'm a doctor, if I'm a local doctor and I'm looking for a periodontist that I want to refer to, what's the easiest, best way to get in touch with you?
Well, you can look us up. Our website is Sheldon and Furtado. You can call, or you can do Michel Furtado, Matt Sheldon. If you Google that, you go directly to our website. The phone number is 321-259-8000. You can call us. You can find us on the website. Our Instagram is Solid Bite. So the office, it's Solid Bite. And if you type solidbite.com on Google, you'll find our website as well. So and my Instagram is Dr. Furtado _perio.
Okay.
So you'll find me somewhere.
Yeah, and that's good. I mean, the easier it is for referring doctors and prospective patients to find and connect with the specialist or doctor that they're looking for, just makes it that much easier. And really also, I mean, that's kind of the start of the patient experience. We want to make it as easy as possible to connect with patients, to answer questions, to hopefully get that connection and help answer their questions and get them scheduled. Yeah. So I really appreciate the time. Thank you so much for coming on, and best of luck to you.
Thank you. It's been a pleasure.
Yeah, looking forward to that new practice when it opens. When is the practice supposed to open?
Well, we hope that it's going to be ready next February, 2025.
So we're coming up.
Yeah. Yeah. The design is ready. We're at the starting the building process now. So
excellent. Well, I can't wait to see the progression. And thank you so much.
Thank you. It's been a pleasure. Thank you, Eric.
Thank you so much. And that concludes our first episode of the EG Dominates Dental podcast. You can find us on YouTube or Spotify. And looking forward to more episodes in the future. So stay tuned.
I was down, but now I'm up.